Hello, my name's Hanwei. I'm your pharmacist, and may I have your name and your son's date of birth, please?
Sure. My name is Yasira, and my son's birthday is May 10th, 2018.
Okay, good. So your son's pediatrician sent you over to our pharmacy, requesting medication for his seasonal allergic rhinitis, or like sneezing nose,
Right.
runny nose, and all that, right?
Yeah.
Okay. So here's the product that I would recommend for you, which is called Nasacort. Um, that is the brand name, and the active ingredient in there is called triamcinolone.
Oh.
Um, yep, it's a topical or nasal like a steroid,
Mm-hmm.
to help with like the inflammation in the nose, and help to suppress the immune system in the nose, to
Mm-hmm.
help with the sneezing and runny nose.
Cool.
Okay.
Yeah.
Yeah. So this is a nasal spray, and it requires me to like teach you about some special instructions on how to use the medication. Do you have a little time
Sure.
that I can go over?
Yeah. Thank you.
Okay. Yep. So first of all, when you just open the package, you would open the cap, and this is only for you to use on the first time, or like I guess like a 2 month or 1 month, if you're not using the medication, which is called priming the bottle. You would just open the cap and point away from anybody or from your face, and just spray 7 to 8 times in the air to prime the bottle. After that, the bottle is ready to use. You got it?
Yeah. Sure.
Yep. And then after that, you can have your son's head lean forward a little bit, and just point the tip at the back of his nose, and spray once in each nostril. So like
Mm.
once in left one, once in right one, once daily, and that's
Okay.
all. Okay.
Yeah.
Yep. So how would you know if the medication is working? So you will see that his sneezing and like runny nose would be clearing up, in like maybe like 3-4 days of use. You would just
Mm-hmm.
see is like coming down.
Oh,
So
okay.
that's how you know the medication is working.
Okay.
And since this is an like topical steroids, and your son is only 4 years old, I would not recommend it. I would not recommend you use this medication for a long time period. It's just around the season that he's having these allergic
Okay.
reactions. Okay, so
Yeah.
it's typically like 1 to 2 months. Okay.
Okay. Yeah.
Yeah. So how would you store this medication is just, after each use, you would take a napkin, like a clean one, to wipe the tip of the bottle,
Mm-hmm.
and put the cap back on, and store it away from sunlight in a room, in a room temperature
Okay.
area.
Gotcha.
Okay.
Yep.
And since this is over the counter medication, there's no prescription. You don't have to refill it. But if it's running out, you just come back to our pharmacy and grab one. All
Okay.
right.
Okay. Sounds good.
And yeah, missed dose. So if you forgot to give your son the dose today, if it's already like nighttime, or like your son's already in bed, don't wake him up to give this
Okay.
dose. Just wait until the next time, or just take it as soon as you're like remembers it. Like if you a day after, it's like 8 a.m. You remembers it. Just is But 8 a.m. might be too close to the next time you're giving the son the dose. If it's too close to the next time you're giving the dose, just skip the one that you already missed. Do not
Okay.
like double up. Like do not do like two sprays.
Ah.
Just
Gotcha.
just do one.
Yeah.
All right.
All right.
Um. So some special consideration is that since this is a topical steroid, just make sure you let your doctor know if he's taking any other like steroids
Okay.
medications, like either topical or systemic steroids, like a pill he's taking, something like that.
Mm-hmm.
Okay. And some adverse effects. Some non like a minor one could be some like dry throat or dry nose. Those you can be managed by like taking a hot shower or like drinking a lot of water. That could help him a little bit. And there's one pretty rare adverse effects, but you do need to contact your doctor right away. Is severe nosebleed. So if you like see your your son's nose is just bleeding constantly, non-stopping, make sure you contact your doctor right away for that. Okay. Do you have any questions?
Nope.
Okay. So since this is like a special instruction, can you just teach back on how to use this medication?
Sure. So when I first use it, I should like take the cap off and aim it to like nobody in the air, not my face, not anyone, and spray it to 7 to 8 times, and it's ready to use. When I'm using it, I should lean my son's head a little bit forward and aim the tip back of his nose, like 1 time of each nose, and once a day. And store it away from sunshine, room temperature.
Okay, and remember to after each wipe the tip and then put the cap back on.
Sure.
Okay, thank you so much.
Thank you.
Yep.